Hello, my name is Cheol Kim. I'm a licensed acupuncturist. Today we're going to discuss about diabetes. And nowadays, modern people who live in modern society having a lot of diabetes patients. So, people who have a diabetes, they have to take a Western medication forever. However, the problem, the control by the Western medication is good, but sometimes when it takes a long period of time, it develops side effects. So people having blindness and heart-related disease and stroke and kidney function failing and neuropathy and then amputating the leg, a lot of things coming up. So people are very afraid of those kind of side effects. So today we're going to discuss about diabetes, how we can treat by naturally, and also I run the clinic, Pinebrook Acupuncture Clinic. We have a lot of patients coming, and not even Los Angeles, and all states in America, they coming by referral from the patient who did our treatment. And the thing is, we are very different from other clinics because of the people who have a diabetes, they have to take forever the Western medication. But people come to our clinic having 3-4 months, sometimes 3 to 6 months treatment. Percentage, let's say about 50-60%, even a little bit more higher, people can get off the Western medication or greatly reduce the Western medication. However, we don't say the cure for the diabetes because of diabetes is a lifestyle disease. But we say maintain control by naturally without having the Western medication. That is a really great prevent some side effect. People who takes the Western medication, it's okay, but if they are really serious, it's very difficult to get off the completely Western medication. No, but beginning or medium kind of status about whatever, and taking the pill 4-5, we helping out for get off the Western medicine or great reduced Western medication and control for that. So that's the way, and people are very, very happy for that because of they don't have to take forever Western medication. So now I'm going to explain how we do the treating for the diabetes. Okay, diabetes is a very important subject, and first of all, I'm going to explain for the Western way of thinking. So diabetes, they have nowadays many people they know about the one type or two type. The one type and two type means the one type is insulin dependent. Okay, so this means they have insulin coming from the pancreas, but a two type. No. I'm sorry, I explained. Okay, the one time is insulin is not coming out from the pancreas, so which means they absolutely almost nothing insulin coming out from the pancreas. But that type 2 is most adult people. This is more like children or the people under 18. They have a lot of one type, but the two type is most like adult people. This one, they have insulin from the pancreas, but somehow they have a resistance. Somehow insulin producing is a little, so that develop diabetes. So that's the Western way of theory, but there are a lot of things in theory. So, but today we are focusing about diabetes by the Oriental way, how we think about how we control for the diabetes. I know this is the Chinese letter, but I'll try the explanation for very simple way. Okay, The Oriental medicine, we thinking those three things, okay? This means the producing heat from the upper way, like a lung area, causing the deficiency about the in. But this one is the heat producing more from the stomach area, and this one is from the in deficiency from the kidney area, and yin and yang balance is the both deficiency. So now I'm going to explanation what does mean for this, okay? So people in ancient time, even 2,000, 25,000 years ago, the Yellow Emperor, they have a name for the book is the Nagyang. And then the book from the Nagyang, even 2,500 years ago, they have written very precisely what the diabetes. And then but a lot of people who suffering like a diabetes with the heat producing upper way, like a lung area, they feel like very thirsty. Even they take the water, they feel more thirsty. And then the Oriental medicine way, we're thinking about some kind of in deficiency. So what does it mean with the in deficiency means in shu, okay? In is the essential fluid our human body. So let's say about the yin and yang balance, okay? So this is the yin, this is the yang, okay? This is the let's say about the normal balance right here. But somehow the diabetes patient yin goes down. So dramatically yin goes down. When yin is the essential with the lack of it, like a hormone, like a blood, it producing slightly heat producing, and then make our body dryness, and then the thirsty, thing like that. But we also, some people have producing a lot of heat from the stomach area. This called, we say about jungso. But this one is also in deficiency. But people who have a lot of heat from the stomach area, they feel like very hungry. So even they eat some food, then only a little bit later, 30 minutes, 1 hour, they're still hungry. So they feel like continuously feel like a hungry feeling. That's what we say about this. The other thing is deficiency about the low abdominal area deficiency. We say about the kidney in deficiency. What does it mean for the kidney? Okay, the Oriental way about the thinking, the kidney is the very important part of the role, and kidney is the more our hormone or very much good organ to have a good balance. So when the yin goes down and there is a lot of ringing sound, and then the hair color getting more gray color, and then start aching for all the joint, and then the man and woman don't have a sexual power, and those things is a kidney yin deficiency. What does it mean as a yin and yang deficiency? This is a both yin and yang deficiency, and this is a kidney this is stomach in shu. This is the in lung shu. Okay. So let's say about the yin and yang deficiency. Okay. When from the people when getting older, when we are 20, yin and yang is very much strong feeling. So that's why we are very, very energetic. Even you study online, even praying online, we don't feel much tired. Even 1 hour sleep, we wake up, we have a great feeling because of we already have built up good yin and yang balance. When we get older, most time yin and yang go down. So this is sometimes when yin goes down, yang still is okay. But sometimes when yin goes down, yin have a influencing to the yang goes down. So this case, yin and yang goes down. So most people is when diabetes long period of time, more than 10, 15 years, feeling like this. What kind of feeling they have is like they have a thirsty, dryness. Sometimes they cold too. Their hand, their feet feel cold and easily get cold. So, the area over here, people get easily cold, they get pneumonia, and they have a, high rate to have a, mortality. I mean, which is more easily get cold to have a, dangerous situation. So, diabetes is, we can say like this by the Oriental way. What I'm saying about the why yin shu yang, so some kind of people, first time they, see me, oh, what does it mean for this? Okay. We try to make a good balance. We don't try to chase the symptom treatment. For example, the Western way of treating is a lot of time symptomatic treatment. They're okay. So people think, oh, I'm sick, I give you the Tylenol, or it's okay. But the way of Oriental medicine, we always a different way of herbs, different way of acupuncture we treating. How? Even some people have a headache, okay? Let's say about instead of aspirin or whatever, we figuring out so many reasons, okay? There is a bunch of reasons we thinking for that, and then we judging for what is good for the herbs and acupuncture. So the diabetes is the same. So diabetes, we treating, we just diabetes is for what, and Western way of, there are a lot of bunch of the chemical kind of drug, but we always checking different. When people have a lung issue, the upper way heat producing, we have we call about Mengmundong Tang, okay? This is the name of the prescription about the herbal medicine. But that is cooling down upper way the heat, and so that our body is very much balanced, so that our body by themselves try to heal for that. So that's the way we can treating for that. And then second, the people who hungry, even they eat something they're hungry, beginning of diabetes, a lot of people having like this kind of a symptom. And then, we put a different kind of herbs, and then cooling down about the stomach area, and then tonify for the yin, and we make a good yin and yang balance. We tonify the yin, how we do that? And there is a lot of bunch of the herbal medicine, like when I write down for Chinese language for like Sengji Fang is the one of the very much tonify for this, and then okay. This is one of the examples to tonify for the yin. So when tonify, we don't feel much tired, we don't feel much thirsty, we don't feel like eye dryness, and then so this is the tonify for the yin like this. When we come up to yin and yang deficiency, we put a more warm material kind of medicine, like we put like this is a cinnamon in the Western way. This is a good medicine. So we're figuring out some of the herbs is these herbs also okay, these herbs also making our body warm, okay? So people have a right kind of herbs to have a making good function, strengthen the organ of the body, liver, kidney, whatever area like that. And then our body noticed, oh, I'm having very good balance, so the body producing very well. So the environmentally is good, healthy way of we making for that. So body by themselves producing better insulin, better quantity of insulin, so that ultimately will control. So beginning and like a medium status about the diabetes patient, for my experience, and they taking 4, 5, 6 pills, most of them they get up and during the 3-4 months and showing up the normal. But we don't say we can cure. Why? Because that's a lifestyle disease. If you, after you being controlled that, if you having like a poor lifestyle, which means you having poor diet, for example, too much meat, too much carbohydrate, and then that's not good. And then you have under a lot of stress, and then you are working too many hours, even you're tired, you're working. Then your body is so much poor balance, and the yin goes down and yang goes down. You know, your body doesn't have a good environment, so that you're producing insulin from the pancreas is not good as like before when you are healthy kind of a condition. So then it come back to diabetes is getting bad. But when you do the herbs, we also recommend good diet and with a good lifestyle, a little bit exercise. We don't want to exercise 30 minutes, 1 hour, just for 5 minutes, 10 minutes, and less Tai Chi and yoga, or anything is more relaxing for your mind and physically. Then you get really well controlled without even having Western medication. Western medication is okay, but a lot of time reporting a lot of side effects, and people are afraid. Some of them is even I taking I don't want to tell the name of the medication, but a lot of them, when patient they come to see me and they saying about, when I'm taking some of the medication, it makes them vomiting and it makes me diarrhea, it makes me headache, and I can endure. Even that patient is 400, 500. Even they try to control by the shot insulin. Even they're hardly adapted to have a treatment. So I see that, oftentimes. So, people who suffering like that, and I recommend the natural way. You even get up the Western medication and control is really good. And if you have a really serious, I recommend slightly to have insulin or, combining with the Oriental way with the other natural treatment together, it's also good benefit. So my thing is, control more naturally, and also reducing a lot of Western medication is a really, really good beneficial to the most of the human beings. Because of if you control by the too much Western medication to control, that means that you might have too much high risk for the build up side effect. Western, I don't say Western medicine is bad. No, Western medicine is good. Even you have a high number, if you don't take the Western medicine, it's more dangerous. But my thing is, even you control with the herbs and reduce the Western medicine to control is really beneficial. That's all I can say for that. Today's lecture is diabetes, and then finally I can say about my clinic. I have lots of testimonial people who have diabetes. People come to see me 3 to 6 months. Even less, and they get up a lot of time Western medicine to control, and people are so happy about that. So if you have more information, you can contact me, and then whatever showing up the number, and then you will be very happy. I'm gladly consult anybody who have a diabetes, and then helping way by naturally, so that you will have a great health and bright future. Thanks again, and then have a nice day. Thank you. Bye.